The numbers of people who have unintentionally overdosed on prescription painkillers has increased at an alarming rate. A recent study in the Journal of American Medical Association says patients taking high doses of prescription medications are at an increased risk of dying. Joining us now is addiction psychologist Dr. Adi Jaffe. Dr. Jaffe, thanks so much for being here.
Thanks for having me.
Tell us a little bit about this study.
Okay, well, this study looked at a sample of Veterans Association individuals specifically, but it looked at individuals who were prescribed these high doses of opiates, as you were mentioning, for pain, and the risk of overdose. The overall risk of overdose they found was low, 0.04%, but in this specific group, and as you already mentioned, this is becoming a more national issue, the risk was much, much higher.
Did they look at why that is? Is that because it's very easy to get sort of used to an opiate and then need more and more?
So yeah, that's one of the ways that you could do it, is you could start building up your doses as you get used to, you build up tolerance for the medication. Another thing is interaction between the medication and other medications you might be taking, especially benzodiazepines and anxiolytics, drugs that sort of like Valium and Xanax and drugs like that, and mixing it with other drugs like alcohol, for instance, is another big issue.
And did they look at who was responsible for these deadly doses?
Well, the question of the responsibility is a tough one to answer, obviously. For the most part, the people who are getting these prescriptions need them for pain, and they're being properly managed. You know, when you go and ask physicians, they're already, a lot of them are really aware of this high dose issue, and they keep people at the doses they need to, and they cycle them through different drugs, so the tolerance issue doesn't become that big of an issue. But you do have a subset of people that no doubt do what we call doctor shopping. They like the feeling that they get under these drugs, and they try to get as much of it as they can. You know, so assigning blame probably depends more on an individual cases.
Now we know that there have been stars like Heath Ledger that have overdosed on combinations of prescription drugs. How can a family member look out for a loved one who may be at danger of something like this?
Right. Well, if you look at a lot of those cases, those are really good cases to highlight the national problem, like I was saying. You know, Heath Ledger, Anna Nicole Smith, a lot of those cases are definitely a good example. We have about 12,000 of those unintentional deaths a year in this country, though, so it's a very big problem. It's the second cause of unintentional death. And some of the things you can look at are relatively simple things, like if you start finding a lot of empty prescription bottles around the house, maybe even ones with different names, because some people use pseudonyms and different names to get the
That's a big red flag, right?
That's a big red flag. The other thing is, if people are taking these high doses, they might be nodding off in the middle of a conversation, be extra lethargic, have maybe droopy eyes and those sort of indications. These are very similar to heroin, so you see the same sort of physical effects.
Now, are some people just genetically predisposed to taking higher and higher doses of these sort of relaxing drugs, right? These are drugs that relax the body.
Yeah, well, these specifically are drugs that kill pain, which are slightly different than muscle relaxants, but they depress, yeah, you're right, they depress your nervous system. So they slow your breathing, slow your heart rate, and all that kind of stuff. Well, that's a really, really good point. I think there's no doubt that there's genetic predisposition. I wouldn't call it predisposition. There's genetic variability in how people respond to these. And that might have something to do with those high doses, right? So some people that might have a really limited response to the drugs might need the higher dose to get the pain response, but that might also get really close to the lethal dose for them.
Now, how do doctors have some way of determining whether a patient may be fudging the truth or perhaps even outright lying about their pain to get more drugs?
So unfortunately, we don't have an objective way yet of telling physical pain. If you've ever been to a doctor, they use that smiley scale to kind of get you to rate your level of pain. But I think one red flag, for instance, is sometimes patients come to doctors looking for a specific drug, maybe even a specific doses, because they know what they need to sort of feed their habit. Those are definitely red flags for a doctor when somebody comes in and asks for that.
Now, if you are having trouble, you personally, where can someone go to get help?
Well, you know, one of the things, so at All About Addiction, one of the things that we really worry about is we get constant emails and calls from people that ask about, where do I find help for my loved one? And that's a really hard, our system in the country is very hard to navigate right now. There are a couple of different resources. The most important thing is if an individual recognizes that they need help, that's a great first step. And then, you know, asking your physician, asking any psychologist you know, or loved ones about help is a really good resource. We actually also have a rehab finder on allaboutaddiction.com that people can go to. If loved ones of an addict start seeing that there's a problem, it could be a trickier issue, because sometimes the addict himself doesn't really want to seek treatment.
I was going to say, we have a lot of high-profile cases of situations like this as well, and that's very difficult.
Definitely. And so there are definitely methods. There's a method called motivational interviewing. That's the psychotherapy method that's specifically aimed to move people from a state where they're not really sure that they want to change their behavior to being ready to change it. There are things like interventions that people are sort of become more familiar
Right.
with through shows on TV. Those works for some people as well. There are ways to motivate people. Once the motivation happens, you still need to find the right treatment.
And quickly before we go, is there a website people can go to get more information?
Yeah, so like I said, allaboutaddiction.com is a website that we have, and we have a rehab finder on there, and you can contact us.
Fantastic. Dr. Adi Jaffe, thank you so much for all of that. And for more information on this important topic and others, log on to the health page at abcnews.com for the latest health news.